Monitoring of carbon dioxide through capnometry and capnography can be a valuable tool in detecting acute alterations in ventilation, metabolism, and circulation. Continuous monitoring of CO2 is an American Society of Anesthesiology standard for basic monitoring in all patients receiving general anesthesia, unless invalidated by the nature of the patient, procedure, or equipment, and for confirming proper endotracheal tube and LMA placement. This is very important. Definitions. Capnometry, this measurement and numeric representation of carbon dioxide concentration or partial pressure in respiratory gases during the inspiration and expiration. And what is capnogram? Capnogram is concentration time display of carbon dioxide concentration sampled at a patient's airway. And what is capnography? That is continuous monitoring of a patient's capnogram during the respiratory cycle. Methods of capnometry. There are two methods. One is side stream capnometer, sample tubing connected to the airway that continually aspirates respiratory gases. The advantages: allows for accurate capnography when attached as close as possible to the patient. It is lightweight and can be used to measure the carbon dioxide and anesthetic gases. Disadvantages: condensation of humidified gases may cause the frequent clogging of the tubing. Water traps and filters must be used to prevent the condensation from reaching the measuring chamber. Delay in measurement response time. So that is important, delay in the measurement response time. Mainstream capnometer. This is mainstream. Light absorption chamber directly attached to the airway. Advantages: direct measurement allows for fast response time. Disadvantages: bulky equipment placed directly in the endotracheal tube does not allow for measurement of anesthetic gases. Technique of carbon dioxide measurement. Number 1, infrared spectrography. In the measuring chamber, the gases are exposed to an infrared light beam. Mass spectrography. Measurement of carbon dioxide and other gas concentrations on the basis of differing molecular weights. Raman spectrography. Use of spectral analysis of scattered light energy. Colorimetric carbon dioxide analysis. This is the fourth one. Number 1, it is a pH sensitive test paper is used. Normal capnogram, there are 4 phases. Phase 1, that is initiation of expiration. Carbon dioxide free gas from the anatomic dead space. And what is phase 2? Expiration of mixture of dead space and alveolar gas. And what is phase 3? That is the alveolar plateau. And what is phase 4 or 0? Phase 0, that is the inspiration. This is the graphic. This is the picture of that clinical use of capnography. Confirmation of endotracheal intubation. This is very, very important thing. Whenever in doubt, use this method to confirm your correct intubation. Phases of normal capnograph. What are the phases? I've already told you. That is, phase 1 is the beginning of the expiration. Phase 2 is going towards the alveolar gases, and phase 3 is alveolar gases which contains more of carbon dioxide. And phase 4, that is going towards the end of the cycle. That is, carbon dioxide keeps on decreasing. Monitoring of adequacy of ventilation in controlled or spontaneously ventilating patients. Non-invasive estimate of PaCO2 assumes the normal 2 to 5 millimeter of mercury difference between the expired, that is PET CO2, and arterial, that is PaCO2, that exists in the awake state is present. The gradient between PET CO2, that is end-tidal CO2, and PaCO2 may be increased with age, pulmonary disease, pulmonary embolus, low cardiac output, and hypovolemia. I will continue in my next video about the rest of the significance of EtCO2. Thank you.